Okay, so we should move on now to our second external speaker, who is Harriet Edwards from Asthma UK and the British Lung Foundation. She leads the Clean Air team at Asthma UK and the British Lung Foundation and manages air pollution strategy, projects and policy campaigns across the organisation. Harriet's an expert in public health policy and has led policy work for different charities over the last decade, including UNICEF UK and the Samaritans. So we're very pleased to have you, Harriet, and she's going to talk about air quality around schools, lung health and COVID-19 reflections from the past year. Okay, so over to you, Harriet.
Thanks, Paul. Just share my screen.
Yeah. That's good, I can see that.
Brilliant, thanks very much. Okay, 1 second, just so I can see it too. Hi everyone, lovely to talk to you all today, and great to follow that really interesting presentation from Kath. I'm going to talk today about the reflections from within Asthma UK and the British Lung Foundation. So it works really nicely actually, because a lot of what I've got to share is about the experiences of people living with a lung condition throughout the last year, how we think this needs to be reflected into policy changes around air pollution, and the different behavioural dynamics we might be dealing with now when we're thinking about the policy challenge around air quality and schools. Oh, so that just summarises what I've just said, hopefully. Great. So, I mean, it goes without saying that last year has been a completely unprecedented challenge for us all. For people with health conditions like respiratory disease who we support, so there's 6.5 million people in the UK at the moment who are diagnosed with lung conditions. So that includes asthma and chronic obstructive pulmonary disease, and also rarer conditions you might not have heard of, such as idiopathic pulmonary fibrosis. And of course, that could be even higher now if we're going to include people with long COVID within that cohort. And there's still a huge amount of question around what that piece looks like, which I'm sure you're all very aware of. So I'll talk today, the evidence I'm presenting is from a series of surveys we carried out during the pandemic. At the peak of the pandemic, we were carrying them out every month. So we had a really good idea of what people were feeling, thinking, and kind of how their care and support had been affected. So yeah, I think it was ultimately, out of all the surveys, it was a very quick change for people to get used to. It's had a huge impact in terms of people's levels of anxiety and mental health impact, and we've seen that throughout surveys as well from government. We had it, like many other charities as well, we had a huge influx in demand for our services. Just for a comparison, in March 2020 we were at 235% of calls and to our helpline, so that's people wanting to speak to respiratory nurses, and continue to see that massive peak in demand throughout the whole of last year. And I know that it's been the same for a lot of other charities, and unfortunately also dwindling financial support at the same time, because obviously there's been a lot of cuts to the ability to run big events such as the London Marathon, which a lot of us rely on for funding. So certainly an unprecedented but really important time for health charities to be supporting the people we do as best we can. It's probably useful just to say as well that Asthma UK and the British Lung Foundation joined together as one charity at the beginning of the pandemic last year. So timing was of the essence, but also quite a challenge for us, managing a merger and also a respiratory pandemic. We quickly, though, were able to ascertain that we had to prioritise COVID and really put the needs of people with lung conditions at the centre of it by making sure that we were gathering those real-time insights. So these were the kind of three big things I've taken from all the survey results, and I think they're useful just for reflecting the policy environment on a wider basis. Is firstly that the impact on people's mental health, anxiety to socialise, anxiety to leave the house, even when restrictions have changed. If they've had health conditions and they've been shielding, there's a whole different cohort of people that are very nervous about returning to normal or what near as normal as possible. there was a lot of people that shielded without officially being told to as well. So I think that's a very interesting category of people, particularly people with asthma who are if you don't have severe asthma, then actually there isn't much evidence to show that they needed to shield. However, we know a lot of our supporters did voluntarily shield, and a lot of them actually said that they would prefer to carry on shielding and lose their jobs if they had to, because there was that level of anxiety. As with a lot of health conditions, there's been a lot of disruption in the NHS. A lot of people haven't gone to their appointments, or they've had their appointments delayed or cancelled. This, in turn, we saw that has substantially affected people's ability to self-manage their lung conditions. And I think this is an important point for when we think about air pollution as well, is that there is this increases people's vulnerability. If you're not managing your asthma well, if you're not managing your COPD well, then it increases your vulnerability to triggers in your environment. And then thirdly, that we're facing already people's incomes have been hit very hard. Obviously, businesses have been hit hard, but we're facing some unprecedented financial challenges as a society as well. Specifically on air quality, we know that amongst our supporters, it's a majority of them, 88% say that it affects their health and well-being on a regular basis. Half the people with asthma told us that it triggers their condition when there's a high air pollution episode. And we surveyed, during one of our surveys during the first lockdown, 1 in 6 people with a lung condition told us that they had seen improvements to their symptoms that they attributed to cleaner air. And obviously the jury's out on how much of the improvements we've seen in local areas, but I think we can all safely say there was a lot less traffic on the roads. And fourthly, a huge amount of people still really want far more information and local data about air pollution in their areas so that they know how to protect themselves. And I'm sure you'll be aware of the Prevention of Future Deaths report that was published this week for the really sad case of Ella's inquest, and this need for public information and awareness was really highlighted by the coroner as a failure for government at the moment, as well as the need to train up medical professionals on this issue so that they can better advise patients and advise them on air pollution exposure reduction, and the need to scale up our legal limits in line with what the WHO recommends. So Kath has gone into a great amount of detail, far more than I could speak to around the science. I think it's useful just to say as well that obviously there's been a lot of different studies in the last year around air pollution and COVID, and there's still a lot to learn. But what we do know is that people that have existing respiratory symptoms are the most amongst the most affected by air pollution, and also experience severe symptoms from COVID-19. So it's very much part of that complex picture, and it really adds another element to ongoing health inequalities within a lot of the same communities experiencing multiple deprivation. So I just wanted to reflect on that, and also, we're going to see far more studies emerging on this as time goes on, and it will be really interesting to see if any stronger links can be made between COVID-19 deaths and air pollution. In terms of policy change and what this means in this last year of context for people living with asthma and COPD, this is Ella, and as I referenced, the coroner ruled this week about the way to prevent future deaths. And I think this is a massive landmark moment in terms of the public momentum behind air pollution, but specifically for children's health. For the TAPAS network, for us all working on this issue, I think it's a really key point for change and really getting cut through with the public, that there is a lot more children in the UK that are being put at risk in a similar way to Ella. Her situation, her condition was particularly difficult to manage, type of severe asthma, but that's by no means an unusual thing in children. We know there are a lot of other cases that we've heard of that are similar, and of course there's a lot more in between. There's 1 in 11 children already living with asthma, and within the school environment, there's it's really at the responsibility of the school to be working with parents to make sure there's a asthma management plan in place for those children. So I think that also has really important implications for the way the school environment's managed and a lot of the specific exposure reduction measures that I know you're talking about later today. There's been a lot of surveys over the last year, and I think a lot of us have said that I think in general there's been a move towards more people wanting clean air because they've experienced what it feels like. I just picked out this survey from the West Midlands because it's a good example of communities living outside London, and you can see that it was really strongly there was a really strong emphasis on people wanting clean air to continue and reduced road traffic and reduced car use. There's obviously been, well, I'm talking about my next slide already. So I've just weighed up here an example of kind of where this is all at, but we've obviously seen a massive funding increase for walking and cycling, which is great for active travel schemes around school and really getting backing for those. As Kath, all the science behind indoor air quality and the way this is integrated, as Kath was referencing, has now been forced to be a priority for a lot of businesses and employers, as well as schools. Potentially all the changes in working from home, and if they're in the long term, could be really beneficial for our quality challenge. If the long-term changes in walking and cycling continue, again, a lot of people are saying that they're going to continue, people that have taken up walking and cycling, but I think we'll have to see what that actually looks like in reality. And there has certainly been a much bigger public debate around lung health, which we know as a charity is not something that has always been the case. And actually, often viruses and colds and flu are not always taken as seriously by the public and government, but I think this is really has forced the issue up the agenda. I think low traffic neighbourhoods has been a really interesting debate over the last year. So these are these neighbourhoods where roads or sections have been closed to different types of traffic under the emergency measures schemes. There's been some really high profile backlash in different communities. But there has also been surveys showing that in general there is a lot of public support for these measures. So there's certainly a piece of work that needs to be done there to really improve public consultation in areas where there's been that backlash and make sure they're working for people and really maximising benefits for air quality as well, because there has been also some difficult cases where it seems like traffic may be pushed in front of schools, for instance, but then in other areas we know that there has been huge benefit for children in schools, and people have reported being able to walk to school in much better and cleaner environments. So I put that in both bad and good news, and I think school streets falls within that as well, because that's a way we can get school streets in with local areas more as well, using the levers around low traffic neighbourhoods, and certainly seems to be much higher public backing for school streets. Our surveying and the DFT surveying and a lot of other insights I've read have showed there is a high reluctance to return to public transport, which is really concerning for the way people travel in the UK and the contribution we know that private vehicles already make. In different areas, on average, it looks like transport hasn't returned to pre-pandemic levels quite yet, which we'd expect, seeing as a lot of people are working from home, but it is getting quite close, and there is still a lot of people working from home. So there's some big questions there around how government are going to manage the tension between transmission of the virus versus our air quality targets and climate change targets, and the need to further protect public health. As I alluded to, we're in a big period of political and financial uncertainty that is only like to continue, which is a bit dark, but we need action on air quality now, and children need it now, and these are urgent changes that are required. So I think we really have to focus as a sector on making that clear case for change. We've seen a lot of delays and scrapped clean air zones, for example, over the last year, which are a good example of the risk we have of the gains we've made in policy being dropped. Okay, in my final reflections, and I'd love to hear any comments from you all around this, because we're certainly got a lot to learn ourselves as well, but we really think as a charity that this is a unique moment for public pressure, for policy change, particularly around children's health and schools and air quality. There's a big opportunity to learn and adapt the way that we communicate on air pollution in terms of health reduction exposure, from how health advice has been communicated on COVID. I think there's a lot we can understand and improve, as well as targeting the most vulnerable communities who we know are most at risk. There is a huge opportunity for government in aligning these agendas and making sure that we're focusing on air quality, and I'm sure Barry's going to talk about this more later, but about building more resilient communities that are more fair, and all of this will help prevent future pandemics. And I know the winter that's coming now, we've got some big challenges on our hands even without COVID, and the government are really concerned about really high levels of flu this winter because of the way the last year's panned out and our lack of exposure. So there's some big challenges still to come even without COVID, but we do need them to persevere, and there's an urgent need to be meeting legal targets and improving our current laws while the environment bill is going through Parliament. And lastly, this is the moment as well for government to be really harnessing the positive behaviour changes, really focusing on that good news column and making sure that we embed these changes for the long term. And there's a lot of evidence showing that you can do that through policy change, and it's the way that they integrate that within the Build Back Better agenda. I think that is also what we all need to be focusing on as the sector, is really embedding air pollution within that response package. And that's it from me.
Thank you very much, Harriet. That's very interesting. I have one interesting question here, which I'm going to relay to you, which is that does Asthma UK or others have sort of case study information like asthma diaries, indicating on a daily level that poor air quality has implications for those who are sensitive to it? Do you have that kind of information?
That's a really good question. We don't have it at that granular level, but I know that's research that different academics I've spoken to are interested in. For instance, perhaps doing it through social media and having a hashtag that people can report symptoms on. So if you're interested in doing that research, certainly would recommend it, and we would love to help. We do have a huge amount of anecdotal evidence though, with people getting in contact with us. We campaign with communities across the UK on air pollution. So we have about 1,000 clean air champions at the moment, who are based largely outside of London, and they are very good at either sharing their own stories or putting us in contact with people on the ground. So we try our best to use those stories to put them at the forefront of media opportunities and really make sure that people's voices are guiding this work.
Thank you. Thanks. That's really very, very informative. Thanks very much, Harriet.
Thank you.